Assalamu alaikum. The topic of today's discussion is predicting parturition in a 3-year-old Labrador Retriever. So the history is that a 3-year-old 28.6 kg intact female Labrador Retriever from an intensely managed breeding kennel presented to the Auburn University Small Animal Theriogenology Service from May 7 to 31, 2021 for the breeding management and artificial insemination. The historically healthy bitch had two uneventful previous litters of puppies, with the last one approximately 6 months prior to the presentation, and was current on preventive care. Upon the initial examination, the bitch was bright, alert, and responsive, with no abnormal examination findings. The vulva was swollen and discharging serosanguinous fluid. The bitch and the sire were tested negative for Brucella canis on the Brucella rapid slide agglutination test. And the serum progesterone and vaginal cytology samples were taken throughout the estrus cycle. The serum progesterone helped to track the hormonal changes leading to ovulation, and the vaginal cytology helped to track the cellular changes in the vaginal lining. The main objective is that to accurately time breeding and predict the due date for the planned elective cesarean section. And the reason of this is that the breeding dates are alone unreliable for predicting parturition, and the accurate timing is critical for successful C-sections to ensure puppy maturity and survival. See the table in the presentation. It is about the estrus cycle timeline. The visual timeline of key events include proestrus, LH surge, ovulation, breeding, as well as cytologic diestrus. In proestrus, approximately 60% of the epithelial cells are present in cornified form, and a moderate amount of RBCs and minimal amount of WBCs are present. Then in estrus, approximately 100% of the epithelial cells are present, which are cornified, and rare RBCs and no WBCs are present. In diestrus, approximately 40% of the epithelial cells are present, which are cornified, and rare RBCs and a heavy amount of WBCs with metastrem cells are present. These were the three results of vaginal cytology samples. The visual timeline of key events of estrus cycle time are proestrus. In proestrus, volvular discharge occurs and the cornified cells are less than 90%, and the progesterone level is less than 2 nanogram per ml. In alleged surge, which is defined as the day before, which is 2 ng per ml. In ovulation, the P4 is between 4 to 10 ng per ml, and in breeding, artificial insemination and live cover is performed. As we speak of cytologic diestrus, the cornified cells drop sharply and the WBCs are reappeared. There are 4 key events which can help in prediction of parturition. These are from breeding 57 to 72 days. It is the widest range and it is least precise. And the second is from LH surge, which includes plus minus 2 days to 65 days. And in ovulation 63 plus minus 2 days, and from cytologic diestrus 57 plus minus 2 days. And the final preparation and outcome was that the pregnancy was confirmed via ultrasound on June 25. Before surgery, monitoring was done. The serum progesterone was checked and the fetal maturity on ultrasound was seen. In serum progesterone, the progesterone was dropping towards the baseline that triggered the labor, and fetal maturity was done by assessing the heart rates and renal development and gastrointestinal contents. The ultrasound probe used was transabdominal. So with the help of parturition prediction, elective C-section was performed on July 25, 2021, and 7 healthy full-term puppies were delivered without any complications. Here the key clinical takeaways are that the accuracy is critical, and progesterone is the key for timing, and vaginal cytology is a practical tool. It confirms the stage of cycle and is a reliable method. Thank you.